IT band friction syndrome hurts really bad. This is one of those injuries that can shut you down as a runner. Pain on the outside of the knee. The IT band runs down the outside of your leg and crosses the knee and attaches on 𝘗𝘩𝘺𝘺 tubercle on your tibia. IT band friction syndrome is almost always a unilateral presentation. We almost never see IT band friction syndrome present on both sides. This is because IT band friction almost always has a mechanical driver. The mechanical driver could be run form, foot type. It could be typical development leading to asymmetry of one limb versus the other. We typically see IT band syndrome present in the clinic as a runner that went out for a long run and ran through pain for the last 20 to 30% of their long run. This often happens 4 to 6 weeks out from a race as a runner is building volume. They may not have a history of lateral knee pain, and then all of a sudden during a long run they start to develop knee pain and they push through it to the point where they can no longer run, or they can no longer run a day or two later because their pain is so intense. Again, this injury can shut you down. It hurts so bad. As runners ramp up mileage, they're prone to this injury if there are underlying mechanical issues in their form or their feet or their lower extremities. This injury typically requires rest. For runners that have a lower volume of base, let's say a runner training for their first half or full marathon and their base for the last year or two is less than 30 miles, I like to recommend 7 to 10 days of rest before trying to run again. The important thing during that rest period is that we initiate some hip strengthening and then we figure out where this injury came from. Runners that have a higher volume base, we almost never see this in, but occasionally you will see a runner as they're ramping up, training for a full, stacking races on each other weekend after weekend. If a runner has a higher base, let's say 40 miles a week or more, they typically don't require as much rest. We see that to be the case with a lot of endurance athletes. The higher base they have, a lot of times the less rest they need because their body is used to recovering a little bit more frequently. Usually when I see somebody in the clinic for this, they have had an episode of knee pain during a long run, they've rested for a period of time, and then gone out for another long run, and they almost always feel pain about 1.5 miles into that subsequent run, almost every time. That's usually when they start to research, what do I do about this, what is this, and then they find us, the running PTs, and we usually see them after that second run. So again, long run, pain is initiated, there's usually a period of rest, and then they run again, and they feel that pain about 1.5 miles in. So why is the pain always presented 1.5 miles? Well, there's 2 reasons for that. There hasn't been enough rest. Tissue is still inflamed, it's still irritated. You see this injury typically present with pain later in the run, almost never early on. The other reason it may still be there, the driver behind the injury has not been addressed. I look at a lot of running injuries as symptoms due to a greater problem. IT band friction is just one of those. The IT band scours the outside of the femoral condyle. There's a small bursa in there that gets inflamed. That tissue is what is irritated. Patients oftentimes want to know what hurts. Well, that's what it is. What's more important to me as a practitioner is where did this come from? My job is to figure out, was it purely an overtraining, overuse issue, or are there some underlying mechanical drivers lending itself to this happening? So when you come in for a PT session, it's important that somebody looks at your run form, looks at your feet, and looks for the driver behind this injury, because solving that ultimately is what's going to get rid of this. So what are the things that cause this IT band friction to happen in the first place? This is a mechanically driven injury in most cases. So the mechanical variables can be the foot. We see forefoot varus a lot of times be the driver behind it. We see a rear foot varus. We see a tibia that is more bowed than the other side. A lot of those issues will lend itself to midline crossover. What that means is the involved side, when the runner is running, that involved side crosses midline. As the foot crosses midline, that creates more relative pronation, which creates more relative internal rotation of the knee. That can drive IT band friction. Some of the other things that can cause it, a lot of times as shoes start to wear out, they become less stiff. The less stiffness of the shoe can create obviously less support, and the knee can start to move a little bit more. I will sometimes see IT band friction after somebody has intentionally slowed down their running with somebody that's a little bit slower than them, or intentionally slowing down to do heart rate training or something like that. And the reason is that when you run slower, there's more vertical oscillation. There's less stiffness, less pop, 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 pop. So more vertical oscillation results in more knee flexion, more sitting back, crouched posturing. That increases flexion at the knee, which increases the time for that IT band to scour across the outside of the femur. The run form impairments that we see that contribute to this are numerous. 9 times out of 10, there's a mechanical driver behind IT band friction when it presents itself. Any unilateral injury, there's almost always a mechanical contributing variable that's causing it to happen just on one side, not the other. So what do you do if you've come down with IT band friction syndrome? Well, I like to recommend a period of rest of 7 to 10 days. This is one of those injuries that I will shut down. I don't shut down everybody, but this is one of those injuries that I will shut down. I think it's important that you see a physical therapist. In North Carolina, we have direct access. You can come straight to a PT without a referral. Most of my patients come directly to me. So during that rest period, there is evidence that supports doing hip strengthening. I like to recommend the hip band series. There's 3 different directions: sideways, backwards, semicircles with a band. I like to recommend the side plank hip circuit that attacks the glute med. Any glute med, glute max strengthening is indicated in this case. The evidence supports it. I don't discourage runners from foam rolling. There's really not a lot of evidence to support foam rolling, especially for IT band friction. A lot of our evidence is in other avenues, but I wouldn't discourage somebody from foam rolling if they feel like it helps. The important thing is that you let the tissue heal and address the driver behind it. When patients come in, I like to watch them run. I look at their feet. We want to look for the problem that created this in the first place and address that. Let's say you come in and identified a foot or a form issue that we want to work on. After that 7 to 10 day rest period, what I like to do is start to work on that impairment, that run form change, or administer an orthotic. If there's a foot mechanical variable that's contributing to the injury, I'll administer an orthotic. So what I have found clinically is that after that 7 to 10 day period of rest, in almost every case, there's going to be a threshold at which the knee will hurt if you were to go for a run. Normally that threshold at about 7 to 10 days is about 1.5 miles to 2 miles. And that's because the tissue is not healed yet. It takes about 21 days for that tissue to heal if you've really beat it up. After 7 to 10 days, typically you can run with no pain if you've given it rest for about the first 1.5 miles to 2 miles. But beyond that, it's gonna start to hurt. And if you run through that pain, you're kind of kicking the can down the road from a healing standpoint. It's important to introduce running after about a week for the next 2 weeks, but you want to stay below that pain threshold. And so if you think, okay, it takes about 3 weeks for this tissue, this IT band friction injury to heal, after 1 week of rest, the next 2 weeks I consider rehab running. So what I like to do is gradually build patients up from about 1.5 miles to 4 miles over the course of about 2 weeks. That works really well for the majority of athletes. Obviously everybody is different. The race that you're training for and when that date is dictates how aggressive we're going to be on our return. The individual's base and how many miles a week they're used to running is going to dictate how aggressive we can be. But generally what I'm doing is a week of rest and then 2 weeks of rehab running, building the individual up from about 1.5 miles to 4 miles. At the tail end of that 2 week rehab running standpoint, once the individual can run about 4 miles with no symptoms, I'm comfortable letting them go with a return to run plan. So what does treatment look like during that 3 week window? Again, you've got rest the first week, evidence-based exercises, maybe some foam rolling if you feel like it helps. Weeks 2 to 3, it's important that there is some running to load the tissue and strengthening continues, but it needs to be pain-free. I have also seen great results with dry needling in deep tissue. I like to needle the vastus lateralis. I like to needle the IT band. We get some pretty big twitches in that area and it just works. I see patients feel a lot better really quickly when we dry needle the tissue that's tight. The most important part of the rehab though is finding the driver and addressing that. So during that 2 to 3 week window, let's say we've identified something as simple as midline crossover on the involved side. It's important that the runner is engaged with avoiding that run form and focusing on the new run form. A lot of runners I see with this are new to the sport and they've never thought about run form at all. So they're surprised when I say that my expectation is that you should be dialed into run form 100% of the time. I want a runner to be able to think about their form the entire time they are running and know exactly what they should be focusing on. That's one of the things we do well here at the Running PTs. We offer gait analysis and gait correction in-house with running injuries. We'll see you if you've got an injury. If you don't have a PT that can help you with your run form, we can help you with that. Just go to runningpts.com and look at our gait analysis services that we provide, in-house and virtual options. So that's it for IT band friction syndrome and how I like to treat it here at the Running PTs.